Bonjour à tous.
Good afternoon. There must be a few Moroccans in the audience. Now, I'm not the coffee break. I am Anass EL HILAL. I would like to thank the Academy of Medicine and the Foundation of the Academy for organizing this event, which gives me the opportunity of presenting my MedTrucks project. MedTrucks provides healthcare in medical deserts with mobile service, and as the name suggested, with trucks. What we've seen today is medical deserts in Africa, for example, and it's a real problem. It's because there isn't the infrastructure required and resources are limited. Given these problems in providing access to healthcare, I wanted to have an innovative approach, providing local service for the communities needing the service. You'll also see that medical deserts can be in France. I'm both French and Moroccan, and I'm based in Montpellier in the south of France. And you'll see that this solution, which was originally designed for Morocco, is also going to be deployed in France. I have a short video.
Lors d'un séjour au Maroc en 2014, Anass est témoin du malaise d'une personne âgée sur le quai de la gare.
Cette scène m'a marqué parce que cette dame revenait de sa séance de dialyse qui était à plus de 60 km.
Pour cet ingénieur biomédical, c'est un déclic. Il fallait trouver une solution.
Je me suis interrogé comment je pouvais aider ces patients qui vivent dans des zones enclavées ou rurales et qui sont contraints de faire souvent des longues distances.
En 2016, il crée MedTrucks, une start-up qui lui permet d'apporter des soins aux habitants à l'aide d'une caravane médicalisée.
L'idée, c'est vraiment d'avoir un hôpital sur roue qui va circuler de village en village.
Avec un système de cartographie, Anass géolocalise les patients. Une fois identifiés, la caravane se déplace jusqu'à eux.
La caravane arrive sur la place du marché, ils auront leur rendez-vous médical déjà programmé et donc ils vont pouvoir accéder aux médecins qui vont leur dispenser les soins. Avec ma start-up, j'espère améliorer la santé au quotidien des populations et à mon échelle, faire progresser le monde. Merci. Donc, effectivement, le postulat que je me suis posé, c'est
the argument that I saw is, why do we ask patients to go to the hospital? Why not take the hospital to the patients? How could we do that? Obviously, with mobile solutions. So medical trucks can be found elsewhere in the United States, Morocco, Canada, Australia. But I wanted to have a service to look after patients and needed to know where the patients were. This meant that I needed mapping so that I could have patient data and then plan a proper mobile healthcare service. Now, the first challenge in Morocco was to get access to the information. In Africa, it's very difficult to get access to patient data. There are no regional or national registries. And so we had to have a system of collaborative mapping. We went off and got the information where we could find it, and that was in dispensaries, in local centers, and from patient associations. In 2016, we managed to map 2/3 of the patients undergoing dialysis in Morocco, and we also organized a study trip with teams from 2 different areas of the country with the first dialysis truck, and you can see that's the one there. And so that's basically how the idea developed until it turned into a health project and a social entrepreneurship project. When you look at healthcare models now, they tend to be global, but they need to be changed. So we used digital tools so that we could set up a new collaborative healthcare model, which was expressed in solidarity. We set up systems where we could identify what the patient's needs were. It depends on patients, communities, regions, and then work out what healthcare was provided needed in their area, and then put the two together so that we could plan on how to deploy our services. But MedTrucks does not produce healthcare. We provide support for hospitals. We urge them to have a MedTruck so that they can provide the right healthcare to the right patient at the right time in the right place. And when a truck moves, it's not just the truck that's moving, but the medical expertise and skills so that we go to the patients in the areas. So it's the idea of transferring the medical entity, facility, and expertise. Our solution was a platform which first had to identify the optimal site in accordance with the needs of the patients in the area and in accordance with the resources available. Then we could work out a smart roadmap using groups of patients involved in this and a medical agent where doctors could say when they were available so that they could go on board the truck and provide the care. So this is to provide local medical service, getting as close as we can to the patient's ordinary living environment. And here we have reverse innovation. Well, MedTrucks has had both national and international awards because access to healthcare is a right, and all societies are trying to deal with the problem of medical deserts. When I developed the project in Montpellier, in France, then I was contacted and was told that they were interested in the option for France in the Greater Paris region and in the Occitania region, down near the Pyrenees. We don't have the specialists needed. We don't have the healthcare facilities needed. And it's not just a question of distance in France, it's a question of specializations. And obviously, there are some groups of the community who are more vulnerable. For example, elderly people who are discouraged from making the effort to go off and get healthcare. So we work with the Greater Paris region at the moment, the Ministry of Health and healthcare centers and facilities so that we can provide this. We have pilot projects. We have one for mobile dentistry in Morocco. It's for dialysis. And each time we work with the local stakeholders so that these can be projects that are viable in the long term. Obviously, there has to be a financial or economic model to make it an ongoing project. We're doing this in a spirit of solidarity. We ask the local authorities to contribute to the deployment of the service. So each local authority pays a subscription so that MedTrucks can be deployed in the area. And they can order days of care online. This can be an ophthalmologist, a dentist, or some other kind of specialist. And then the healthcare provider is paid according to the conventional habits and lines of payment. Here we have our team with different areas of expertise. We see this as a social approach. We've got organization. We've opted for mobility so that healthcare can be more readily accessible. And we have partners who are involved who are doctors. We have people who are experts in mapping and data analysis so that we can find the right IT solutions together and the right social solutions. In conclusion, I'd just like to go back to what the WHO said about the right to health, because the right to health includes access, the right time to acceptable health care of satisfactory quality at an affordable cost. So you can see there are three key lines in access to health care here. The first is that it has to be done in relevant time frame. So it's the time that you might have to travel to go and see a specialist. Then there's the question of physical accessibility, whether you have to cross mountains or plains or whether there are transport facilities available for the patient and can be taken by the patient. And then you have the question of the financial resources required. They have to be affordable. There's no point in having healthcare if the patient can't afford it. So we see these as three basic indicators, and we want to have each patient within 15 minutes of healthcare facility. And the advantage of mobile facility is that we don't have physical boundaries. If you share with our ideas, please go online and connect up with us on site so that we can all work together and have access to healthcare for all. Thank you.